There's this incredible, almost invisible bond between a mother's health and her baby's development. Today, we're going to dive deep into that connection, specifically talking about maternal diabetes, and uncover just how much it can shape a new life right from the very start. So, it really all boils down to this one big question. Think about it. The womb is literally the baby's first home, and the mother's body is the architect, builder, and environment all in one. So what happens when that environment gets tweaked, even slightly, by something like diabetes? Well, the effects are way more profound than you might imagine. Okay, so let's get on the same page with a quick definition. Now, we're covering all types of maternal diabetes, but a really key one is gestational diabetes, or GDM for short. This is the kind that can just pop up during pregnancy, even in women who've never, ever had diabetes before. It's usually temporary, but man, its impact can be pretty significant. So, right away, the challenges can start to appear. The first set of hurdles really shows up during the pregnancy itself, creating a whole series of potential issues for both mom and the baby. And these risks, they really run the gamut. We're talking about things like polyhydramnios, that's just a fancy term for too much amniotic fluid, and preeclampsia, which is a really serious blood pressure condition for the mother. And then there are the more sobering risks, like a higher chance of fetal loss. For moms with pre-existing type 1 diabetes, a dangerous condition called ketoacidosis can be a huge mortality risk for the baby. It's exactly why super careful monitoring is just absolutely crucial. So beyond just the pregnancy itself, maternal diabetes can actually get in there and directly mess with the baby's fundamental developmental blueprint. I mean, it can affect how they're formed from the absolute earliest stages. And here's a number that really puts it all into perspective. 6%. That's the overall risk of congenital malformations for these babies. Now, I know 6% might not sound like a huge number on its own, but get this. It's a four-fold increase compared to babies born to non-diabetic moms. 4 times. Just to really visualize that four-fold increase, the risk of these kinds of malformations jumps from about 1.5% for the general population all the way up to 6% in diabetic pregnancies. That's a massive leap. And we're not just talking about abstract risks here. The data points to a higher chance of some very specific, very serious conditions. Things like malformations of the heart, a super rare condition that affects the lower spine called sacral agenesis, and even problems with how the colon develops. Now, here's where things get really fascinating. It's how maternal diabetes can affect the baby's size. And it's kind of a paradox, actually, because it can push the baby's growth to two complete opposite extremes. So, on one hand, you've got macrosomia, which is a big word for the baby growing unusually large. But on the other hand, you can have something called intrauterine growth restriction, or IUGR, where the baby is actually much, much smaller than average. Macrosomia is definitely more common, and the growth restriction tends to happen more with mothers who've had diabetes for a long time and it's started to affect their blood vessels. And if we just focus on that more common outcome, the extra-large baby, you can see just how prevalent macrosomia is. About a quarter, 25% of all infants of diabetic mothers are born macrosomic, weighing over 4 kilograms or 8.8 pounds. That is a huge jump from the 8% you see in other pregnancies. So how does this even happen? Well, it's basically a clear chain reaction. First, the mom's high blood sugar crosses the placenta right over to the baby. The baby's body reacts like, whoa, that's a lot of sugar. And its tiny pancreas kicks into overdrive, pumping out extra insulin. And here's the absolute crucial part. In a fetus, insulin acts like a superpowered growth hormone. It's what's directly fueling all that extra growth. And this isn't just about having a chubby, cute baby. It can have serious real-world consequences. One case study tells a really stark story. An infant weighing 5.5 kilos, that's over 12 pounds, was born a month early and ended up with a nerve injury in their shoulder during birth, all because of their size. And the hurdles don't just stop at delivery. For these newborn babies, the first few hours and days of life can bring a whole new set of unique health problems that need immediate care. Yeah, so once the baby's born, they face a new set of challenges. Remember all that extra insulin they were making? Well, now that they're cut off from the mom's high sugar supply, that same insulin causes their own blood sugar to plummet. It's a condition called hypoglycemia. And that whole metabolic situation can also delay lung development, which leads to respiratory distress, and can even cause issues with the heart muscle and an overproduction of red blood cells. All right, so after laying out all of these really serious risks, you're probably wondering, okay, so what can we do about it? And the answer is actually incredibly powerful and it's surprisingly straightforward. It all comes down to one single factor. The answer, the key that unlocks a healthier outcome, is one thing: meticulous control. Meticulous control of blood glucose. This is the single most important piece of the puzzle in preventing pretty much all of the complications we've just talked about. So what does meticulous control actually mean? It means carefully, diligently managing blood sugar levels, and not just during the pregnancy. Ideally, it starts before conception. This kind of proactive, continuous management has been proven to dramatically, markedly reduce the risks for both the baby and the mom. It can turn a really high-risk situation into a totally manageable one. And all of this brings us to one final, really vital thought. We've just seen that knowledge and careful management can literally change everything. So it leaves us with a question, right? If awareness and control are this powerful, how can we do a better job of supporting every single expectant mother on this critical journey?